హాస్పిటల్స్లో రెసిస్టెంట్ హైపర్టెన్షన్ అండ్ ఆర్డిఎన్ థెరపీ గురించి డిస్కషన్ అయిందండి. రెసిస్టెంట్ హైపర్టెన్షన్ అంటే మనం మందులు వాడినా కానీ అట్లీస్ట్ 3 మందులు వాడినా కానీ బీపీ 140/90 కన్నా ఎక్కువ ఉన్నప్పుడు దాన్ని రెసిస్టెంట్ హైపర్టెన్షన్ అంటాము. ఇప్పటి వరకు మందులు కాకుండా వేరే థెరపీస్ ఏం లేకుండే, కానీ లేటెస్ట్గా ఇప్పుడు ఆర్డిఎన్ థెరపీ అని, రీనల్ డీనర్వేషన్ థెరపీ అని వచ్చిందండి. దాంట్లో ఒక చిన్న క్యాథెటర్ కిడ్నీ వెసల్స్ లోపల తీసుకెళ్ళి అక్కడ నర్వ్స్ని మాడిఫై చేస్తాము రేడియో ఫ్రీక్వెన్సీ అబ్లేషన్తో. దాంతో బీపీ ఆల్మోస్ట్ 10 mm నుంచి 50 mm వరకు తగ్గే అవకాశం ఉంటుంది. అది మెకానిజం ఎలా ఉంటుంది, దాని అడ్వాంటేజెస్ ఏంటి, ఏ పేషెంట్స్కి మనం ఈ థెరపీ ఆఫర్ చేయాలి, ఆ డిస్కషన్స్ అయినాయి ఇవాళ. అండ్ ఈ లేటెస్ట్ థెరపీ ఇప్పుడు మన కంట్రీలో, మన స్టేట్లో, మన సిటీలో అవైలబుల్ ఉంది కాబట్టి ఎవరికైతే ఇలా బీపీ కంట్రోల్లో లేదో వాళ్ళు ఈ టెక్నాలజీ అడ్వాంటేజ్ తీసుకోవచ్చు. నో స్పెసిఫిక్ ఏజ్ గ్రూప్, అంటే పీడియాట్రిక్ చేయరు, కానీ అడల్ట్స్, ఎనీ అడల్ట్ పేషెంట్ ఇట్ క్యాన్ బి డన్. అది చేసే ముందు వెసల్ సైజ్ చూస్తాము, వెదర్ ఇట్ ఈస్ అడిక్వేట్ టు డూ ఆర్డిఎన్ ఆర్ నాట్. అది అడిక్వేట్ ఉంటే చేస్తాం. 1 సెషన్లో కొంతమందికి 10 mm, కొంతమందికి 20, కొంతమందికి 30 mm అలా డ్రాప్ అవుతుంది. జనరలీ మానిటర్ చేస్తూ ఉండాలి. కొంతమందికి క్యాచప్ అంటారు, అంటే ఇనిషియలీ బీపీ కంట్రోల్లో వచ్చినా కానీ ఒక 6 months కానీ 2 years తర్వాత బీపీ మళ్ళీ ఇంక్రీజ్ అయ్యే అవకాశం ఉంటుంది. బట్ ఇట్స్ అ రిలేటివ్లీ వెరీ సేఫ్ ప్రొసీజర్. సో అవసరం అంటే మల్టిపుల్ టైమ్స్ కూడా చేయవచ్చు. ఇట్స్ నాట్ ఏ ఇష్యూ.
Today at AIG Hospitals, we discussed some important aspects. One is resistant hypertension, and it is an under-assessed condition, and it's an important health condition which is prevalent in our country. And a lot of young patients are having a undetected hypertension, and a lot of the patients who are having a hypertension, they are having a resistant hypertension. So this group of patients, the another new therapeutic option which is available is called as renal denervation therapy. So once we kind of systematically evaluate them and select that this is a candidate for the renal denervation therapy, then it's relatively a very simple procedure which can be completed in 45 minutes to 1 hour, doesn't require any anesthesia, and it's a safe, well-studied procedure across the globe, which is there in the global arena for last 1 decade, but last 2 or 3 years or maybe 4 years, it has undergone substantial refinement as far as the therapy is concerned to make it more effective. And it's a one-time therapy. It's not that you have to come to the hospital repeatedly for this procedure. So to summarize, for a select group of patients, what we call as those who are having a resistant hypertension, this renal denervation therapy is effective, safe, and it's a one-time treatment. Thank you.
Today we had a discussion on renal denervation therapy, which is a new therapy for resistant blood pressure hypertension patients, people who actually take a lot of medication despite which there is no control on the blood pressure. These people, we have a catheter-based therapy now. It's a new therapy that's come into the world and country now, and it's doing very well. We pass a catheter into the kidney arteries, burn few nerves there because the kidney actually controls the blood pressure. So once we burn those nerves, automatically the blood pressure start coming down. That happens automatically, the number of medicines come down, patients feel better, the requirement of medication comes down, automatically the side effects of medicines come down, the complications of blood pressures come down. So automatically life becomes better, less complications because of blood pressure. It's a great therapy, but not for everybody, for people who don't get control despite medication. No, basically I think because of the food habits, stress levels, the work pattern, sleep pattern, all this I think is contributing to blood pressure even in the younger people. Probably post-COVID, a lot of younger people are actually developing blood pressures also. So, but I think they get controlled pretty okay with blood medicines. Despite which, if they don't, then yes, this is a therapy for age is not a bar here. Blood pressure, despite medication for a long time, that is a bar. So that is what we need to see. I think to avoid blood pressures, the most important thing is salt. Once you reduce salt, half the battle is won. Then I think regular exercise, proper diet, lot of fruits, lot of green leafy vegetables, less fried stuff, less bakery food. That's every bakery food will have salt or a lot of dalda and ghee and all that. So that actually helps in reducing blood pressure. Alcohol, smoking is one more major issue. I think alcohol and smoking we didn't talk about, but I think smoking is a major contributor because it will thicken the arteries, and then any amount of medication will not help. So that's one thing that I think everybody should stop. Tobacco in any form, be it chewing tobacco or smoking tobacco, I think it's very important that we stop tobacco. We just admit the patient for one day. It's a local anesthesia procedure where we give a small nick in the groin and we pass a catheter into the kidney arteries and give small electrical burns in the kidney arteries and just come out. It's probably a half an hour procedure, and once it's done, patient is shifted to the room the same day, discharged the next day morning. And over a period of the next 2 to 3 months, the blood pressure consistently starts coming down, where then we keep following them up and reducing medicines. Cost wise, it's a little costly at this point in time, but it's like any other technology. As the number of people start using it, the cost keeps coming down. But if you look at the cost versus the benefit that somebody gets, it's a huge benefit. And over a period of time, if you look at the money that somebody is going to spend on complications of blood pressure, the number of tablets of blood pressure, automatically, if you look at it, it will equalize at some point.